Hello and welcome to The Explainer. Today, we're going to dive deep into a condition that messes with one of the body's most basic, most critical functions, its ability to handle stress. Just think about that for a second. What if every time you got sick or hurt yourself, or even just faced a moment of intense physical pressure, what if your body just couldn't cope? What if that became a life or death situation? Well, for people with adrenal insufficiency, that's not a what if, it's their reality. It's a condition where the body's crucial hormone factories basically shut down, leaving it almost completely defenseless against the stresses of everyday life. So, to really get a grip on what's going wrong here, we first need to understand what's supposed to go right. Let's meet the body's own team of stress managers, starting with the hormone factories themselves. Okay, so meet the adrenal glands. You've got two of them, these little glands sitting right on top of your kidneys. And they might be small, but they are incredibly mighty. They're the ones responsible for pumping out steroid hormones that you literally cannot live without. And these glands really have two superstar products. First up, you have cortisol. Think of it as the stress regulator. It's what helps your body deal with physical stress, it keeps your immune system in check, and it bumps up your blood sugar when you need a burst of energy. Then you've got aldosterone, the balance keeper. This one's all about managing your salt and water levels to keep your blood pressure stable. And here's the bottom line. You absolutely need both to survive. But, these glands don't just act on their own. Nope. They're part of this really elegant, really delicate chain of command that starts all the way up in the brain. This whole system is called the HPA axis. Here's how it works. Step 1, the hypothalamus, which is kind of like the command center in your brain, sends out an order using a hormone called CRH. Step 2, the pituitary gland gets that message and relays the command by releasing its own hormone, ACTH. Step 3, ACTH travels down to the adrenal glands and tells them, okay, time to release cortisol. And then this is the really cool part. That cortisol travels back up to the brain and says, hey, mission accomplished. You can stand down. It's a perfect self-regulating feedback loop. So what happens when this beautifully balanced system breaks down? Well, a failure at any point in that chain leads to adrenal insufficiency. But where it breaks actually tells us what type of insufficiency we're dealing with. I love this analogy because it makes it so clear. In primary insufficiency, the problem is the adrenal factory itself. It's just broken. The brain is shouting out orders, sending tons of ACTH, but the factory can't respond. In secondary, the pituitary factory manager is silent. It never sends the ACTH order out in the first place. And in tertiary, the CEO way up in the hypothalamus has just shut down the whole operation. And see that last column? The key diagnostic clue is the ACTH level. If it's high, you know the factory's broken. If it's low, you know the problem is with management. Okay, so that's what's happening on the inside. But how does this internal failure actually send out clues to the outside world? Let's play detective and look at the signs that tell us something is seriously wrong. Now here's the tricky part. The early clues are super vague. Fatigue, muscle weakness, tummy pain, that could be anything, right? But look at that one right there, a craving for salt. That's a huge tell. That's the body literally screaming for the sodium it needs to balance its electrolytes, a job that aldosterone just isn't doing anymore. But in primary adrenal insufficiency, there is one really unique, almost unmistakable sign. The skin starts to get this bronzed, darkened look. So why does that happen? Well, remember how in the primary type, the pituitary is just screaming out ACTH, trying to get the broken adrenal glands to listen? Well, that huge amount of excess ACTH also happens to stimulate your melanin-producing cells. So you get this hyperpigmentation, especially in places like the creases of your hands or in old scars. The second major clue is something called postural hypotension. What this means is when the person stands up, their blood pressure takes a nosedive. We're talking a drop of more than 20 points. And it's a direct result of not having enough aldosterone to help the body hold on to salt and water. Without that, you just don't have enough fluid volume to keep your blood pressure up. That's what's causing all that dizziness and fainting. So you've got these clues. How do doctors put the puzzle together and make a definitive diagnosis? And more importantly, once it's confirmed, how do you live with this day in and day out? The gold standard, the test that gives the final answer, is called the short Synecthen test.
It's actually pretty clever. Doctors inject a synthetic version of ACTH to directly challenge the adrenal glands. It's like they're saying, okay, factory, here's a direct order. Let's see what you do. If the cortisol levels shoot up like they're supposed to, the glands are fine. But if they don't budge, well, that's it. It proves the adrenal factory is broken and you have your diagnosis.
So, how do you manage it? Well, it means lifelong hormone replacement. You have to give the body what it can no longer make for itself. That means taking hydrocortisone to replace the missing cortisol and fludrocortisone to replace the missing aldosterone. Patients basically have to become their own adrenal glands, constantly monitoring themselves, carrying emergency ID, and knowing exactly how to give themselves a life-saving injection if things go south. And that brings us to the single most important non-negotiable rule of managing this condition. Anytime the body is under physical stress, we're talking an infection, a fever, surgery, anything like that, its natural demand for cortisol goes through the roof. So patients have to mimic this by doubling their steroid dose. This isn't a suggestion, it is an absolutely critical rule to prevent a life-threatening crisis. Because if that rule isn't followed, or if the disease goes completely undiagnosed, the situation can escalate very, very quickly into an acute medical emergency. And this is what's known as an adrenal crisis, or sometimes an Addisonian crisis. This is the moment where the body has completely run out of the steroid hormones it needs to function, and everything starts to catastrophically shut down. The signs of a crisis are just a complete system collapse. The patient can become confused or lose consciousness because their blood sugar has plummeted, their blood pressure crashes, and all those electrolyte imbalances we talked about, the low sodium, the high potassium, they're now at critically dangerous levels. This can be triggered by something as simple as the flu in a patient who already knows they have the disease. And for some people, tragically, this crisis is the very first time they even find out they have adrenal insufficiency. Thankfully, even in this crisis, there is a clear and effective emergency response. First things first, you give hydrocortisone immediately, no waiting. At the same time, you're pushing IV fluids to get that crashing blood pressure back up and giving IV dextrose to fix the dangerously low blood sugar. Once they're stabilized, it's straight to the hospital for close monitoring. It's a real race against time, but it's a race that can be won. So when you step back and look at all this, what's the real takeaway? Understanding adrenal insufficiency is more than just learning about one disease. It's this incredible window into just how complex and, frankly, how fragile our bodies are. And it really makes you wonder, doesn't it? If this is the chaos that unfolds when just one tiny link in one system breaks, just how many other silent, invisible, absolutely critical systems are working perfectly inside you right now just to keep you going?